So today we'll just look at some of the basic signs of a healthy heart. I decided to look at this topic today because I've seen that when it comes to cardiovascular, that is the pulmonary, your transportation system, how blood flows from the heart is the pumping machine. It pumps blood to all the various parts of your body, you know, and this blood carries oxygen to feed these organs for them to function optimally. So that pumping machine has to be oiled very well so that it can perform optimally. So number one, you need to check your cholesterol level. Of course, the doctors will do that. Healthy cholesterol level. Once your cholesterol level is healthy, according to the doctors, then you sure that your heart is functioning very well. Another thing you need to look at again is your blood pressure, your levels. You need to be 120 over 80 systolic and diastolic. 120 over 80 millimeter mercury. That's the measurement they use. So when you take your blood pressure and it's within 120 and that 80, then you know that your heart is working healthy. You need to look at your normal resting heart rates. When you are resting, how is your heart pumping? It's, they say, between 60 and 100 beats per minute. Of course, the healthcare givers will assist you in that. So if you are between 60 and 100, you know that yes, your heart is working very well. That is your normal resting heart rate. When you are resting or you are not doing exercise, your heart rate should be between 60 and 100 beats per minute. Then healthy energy level. If you're always tired, any little thing you are tired, you take the staircase, you are tired. Okay, that tells you that your heart probably is not functioning very well. So, and that's why we don't encourage you to keep sitting down. Even in the office, I keep saying it. From time to time, stand up deliberately, go out for lunch. Deliberately go and see your colleague in other parts of the company. Gossip a little and just move around. It is very, very important. Because the nature of your job, you sit down continuously. So please, so move around, do some exercise. Good exercise tolerance. And this is very, very important. If you want to embark on any exercise regime, please seek the advice of a healthcare practitioner or maybe your caregiver, please. Because we have seen people who come for exercise and before they know what, that's the tolerance and they just collapse and that's the end. Okay, so good exercise tolerance is also very key. Don't rush yourself. And for me these days, personally, I don't even jog again. I walk. In my younger days, I used to jog, but now I walk. Bricks walking. That kind of, I walk. So please, and all those fitness experts that you go to some of these gyms and all that, please, talk to them very well before you start. Because most of them are experts when it comes to some of these little issues. They know a regime to place you, and don't go to a gym because you see that one person has been doing this kind, and is tolerating it. Then you too, you want to do it. Please, because there is a case of a young man. He went to a gym. He saw that this treadmill. He saw the young lady, was doing it very well, and decided to say, okay, he's too going to do it. As soon as he stepped into the treadmill, in fact, he just went off. Because something you have not done at all. You need to take some time. So good exercise tolerance. Yes, gradually, you know that your heart is working very well. Then, of course, your steady breathing pattern. If you stay close to some persons, you will keep seeing how they are panting. Meanwhile, they are just sitting down. You will feel it. Yes, that shows that that is usually comes with overweight people, and all that, and it shows that there's an issue with the heart. That is a steady breathing pattern. Then I will not leave here without mentioning healthy weight. Yes, healthy weight. You know, I've seen some person, oh, you're overweight. Oh, the best way to know is to do what they call your body mass index. Yes, that is your body mass index. How does that work? Very simple arithmetic. Your body mass, your height, and your weight. You measure it. You know, that's why at times when you are going for certain recruitment, you know, maybe if to enter the armed forces, another paramilitary, they take your height. They ask you stand here. They record your weight. Take your height. They are calculating your body mass index. Yeah, it's as simple as that. They will not tell you. In fact, certain jobs, if your body mass index is not within a certain level, you will not be, you know, accepted. So the number one is 18.5 and 24.9. That is for your body mass index. If you fall within that, you know that yes, your heart will be working very well. In all these are little signs you can observe yourself. But we are saying always seek the advice of your caregiver. It could be a family physician, it could be a government hospital, but make sure that this is the beginning of the year, you take advantage of that. In fact, I think in December, I saw a lady who told me she has been diagnosed as having, I don't know the type of diabetes, whether it's type 1 or type 2, but she was happy that after that diagnosis, the healthcare practitioners even taught them how to inject themselves using the insulin. So you can see self-care. You have been taught how to do it, and she will take care of herself. Being diagnosed as you are a diabetic patient or you have high blood pressure is not a death sentence. We know people who manages these illnesses over 50, 60 years and they live healthy. As long as you follow the instructions and prescriptions of your doctor, and of course, you live healthy. So let's be conscious, take our health, because health is wealth. Health is wealth. What's the essence of creating wealth and you don't have that health to enjoy it? So we must be intentional in taking care of ourselves. Rest properly, have a good night's sleep, sleep at least 7-8 hours a day, you know. And of course, when you wake up, you will walk, you will feel healthy, you will walk. So, and once in a while, or try and create a schedule where you can exercise yourself. Ensure that even in your offices, and that's why today I'm so happy, some offices, they have even created a small gym where people can do some little exercise and all that, you know. Don't always use the lifts. If you work in an environment where there is a lift, from time to time, let's say your office is on the third floor, fourth floor, even fifth floor, you can do bricks walking, you know. Yes, and that will keep you healthy. Especially, okay, you are resumed, maybe you are going for lunch. Please use the staircase down. Also use the staircase up again so that you will move your body. And of course, your heart, like I said, the heart is like a pumping machine. It pumps blood to all parts of the body. And how does it pump those blood? They say, okay, it is the veins, the artillery, the capillaries. They pump to various organs, and these organs need this oxygen, you know, to perform very well. When you eat, the food is broken down, you know, that is the energy that you need and all that. The pipes are these arteries and veins, you know, they some take blood to the heart, some take blood away from the heart, they take blood to the brain, you know, they purify. So it's a purifying system, okay? And you must ensure that those valves, those pipes are cleaned. Yes, and they are working well, you know, and they are not, the blood is not exerting pressure on those pipes. And when they exert too much pressure, that's why you say you have high blood pressure, okay? So, but if the pipes are clean, the blood will flow, you know, easily and to all parts of your body, and you will live a healthy life. So, thank you, and I assure you, as we begin this new year, it's going to be health for all. by the year. In fact, it's Health for All 2025. We're going to be health conscious in terms of what we eat, in terms of our activities. We're not going to continue that sedentary life style. We're going to be healthy so that we can be wealthy. Thank you.